So this is a right knee. Got the tibia here, fibula here, femur here. This is the quadriceps tendon, and sitting inside it is the patella. Quadriceps tendon runs down into the tibial tuberosity. We have the lateral collateral ligament here, a thin ligament. And then we've got the medial collateral here, which is a thick band, yeah. And then within the knee, we have two menisci. The lateral menisci, which isn't attached to the lateral collateral ligament. And then the medial menisci, which is directly attached to the medial collateral ligament. And the MCL, the medial collateral ligament, and the meniscus work with the anterior cruciate ligament inside the knee. So there's two cruciate ligaments inside the knee that cross over. And cruciate means crossover. Got the anterior cruciate ligament, which stops when the foot's on the ground, it stops your tibia being slid off your femur that way. And then the PCL, the posterior cruciate ligament, does the opposite thing. Okay. The knee itself is a hinge joint. It can flex, extend, and when it's flexed, it can then also rotate. Muscles that cross the knee, or that allow the knee to work, are the quadriceps, rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis. And then you've got at the back, you've got the hamstrings, which are biceps femoris, semimembranosus and semitendinosus. And then below, coming up, we've got gastrocnemius, which crosses the knee and attaches into the femur. And then you've got the adductors, gracilis sartorius crosses the knee. And then we got haven't really got any muscles that cross the knee at the front, I don't think. No, and then the perineals here, but they don't actually cross the knee. The other part of the knee joint is the Tib-Fib joint here, the proximal Tib-Fib, proximal meaning close to the body. There is another one, a distal Tib-Fib joint, further down by the ankle. That is pretty much the structure of the knee. Now, when I said the ACL stops the sort of the tibia coming off this way with the femur that way, another muscle that works with the ACL is the hamstrings. So if you get a hamstring problem, I'd be looking at the knee joint as well, and vice versa. Look at the knee joint, you got to think about the hamstring that works in concert with the ACL to keep that knee stable. Also, other stabilizers of the knee, you've got the Iliotibial Band, which is the tendon of the glute max, or the glute group in general. A lot of physios look at the glute in that case for stability of the knee. Again, if you're thinking about rehab of the knee or anything to do with the knee, you have to be thinking about all those muscles that are farther away from the knee joint, as well as the local musculature and structure of the knee. Okay, I'd be looking at the foot, the ankle, the distal Tib-Fib joint, the proximal Tib-Fib joint, the knee itself, and then further up in the hip and probably the lower back if I was looking at a knee issue. And all the associated muscles. I'd also look, if this was a right knee, which it is, I'd also be looking at the left leg to look at any inadequacies or compensations that are going on whilst this right knee was injured.